Hello, everyone, and welcome to Trent Radio 92.7, coming to you from Peterborough. This is Stephen Haylestrom, and let's talk housing this year. And this is the first broadcast of 2024, coming to you in the first week of January. And as I have noted in uh, po- uh, previous previous shows, this comes as a weekly radio show, but also as a podcast you can find on all your podcast apps. And the objective really is to talk about housing, talk about the housing crisis, talk about what the effect is of the housing crisis and how it affects everybody. And this week and this month of January, we're really going to focus on the effects of not having good housing. And today, I'm going to have excerpts from a CBC program that aired just a couple days ago called The House. You can find it on cbc.ca/radio. Look up the program The House. It aired on January 6th originally, and it's talking specifically in the show itself, which is really a good show to listen to if you get a chance, a good podcast. And I'm going to play some excerpts from it and then talk around those excerpts. Then in our second half, we are going to also bring you excerpts from another program. Hey, but there's some good stuff out there right now on housing and homelessness, and I want everybody to be able to hear it. And the second one is really all about the effect not only on the people but on our society and on how we live and how it creates relationships of the whole idea of tent cities around the country and how the police are interacting, etc. And this is another program from CBC, from the Current, and then we'll talk about that as it goes through. Oh, plus a little excerpt on pets and homelessness and how effective they are and wonderful they are for people who are unhoused and living on their own, and a charity that actually goes and helps and does veterinary clinics. And spoiler alert here, but for the most part, the pets are in better health that are kept by people who are homeless than the ones that are in people's homes. So, interesting for sure. And then over the next few weeks, we're going to get some lived experience and discussion about the real effects of housing, of not having housing. And then towards the end of the month, we're going to talk about the path to solutions. Solving the housing crisis is really such a multifaceted challenge, right? Like everyone knows every week, if not every day, on radio, on social media, on every broadcast medium in Canada and really in North America and other parts of the world, people are talking about the lack of housing, the lack of adequate housing for regular people. And the crisis is immense. The number of people who are becoming unable to be underhoused and unable to be housed is increasing all the time. Today, the spotlight, even though, this program, The House, is really about, the running of the government. It normally has interviews with politicians. But they're doing a special series on the toxic drug crisis. And in this first episode that they've aired already, they talk a lot specifically about the effect of the lack of housing and how the lack of housing brings people into the world of addiction and the use then from addiction to the use of toxic drugs. And this isn't like I'm not a young kid. So when I was growing up, drug addicts, there certainly were drug addicts, but it was a whole different world. Now, as in this first clip I'm going to play, you'll hear that statistically, it's just it, it's it's crazy. So I'm going to play this clip from the show right now, just so that you can hear it directly from the show.
Something has to be done. We heard that from so many people, no matter their politics, when it comes to the toxic drug crisis. When the House started our special focus in the fall, the latest figures showed on average 21 people were dying every day from opioid overdoses. Just before Christmas, new numbers from the Public Health Agency of Canada revealed it's now an average of 22 people per day.
There you go. Statistically, 22 Canadians die every day as a result of toxic drug overdoses in this country. And a substantial percentage of the people who die, one of the contributing, the large contributing factors to this is that their inability to be housed, and to be housed either to be housed themselves, to be in a treatment program, to have our society create an environment that allows them to grow and act and become the people that they can be. So imagine 22 people per day, 365 days a year. That gives you over 8,030 people, Canadians, who die as a result of drug overdoses every year. More than all the damage of COVID. More than it has now become, as I'll play another clip later on, it's now become the leading cause of death for people between, I think it's 18 and 45. So, now, this relates to housing because there's an alarming trend that intertwines the lack of affordable housing with increasing drug overdoses that's exacerbated by the toxic drug supply. There is a correlation really between some very critical issues that need to be understood and addressed to deal with the root causes effectively. The epidemic of drug overdoses in Canada has reached unprecedented levels, with opioids being the leading cause, and tainted opioids that are bought on the street. The second, and I'll talk about that and the relationship. I don't want to lose the relationship. So yes, people are involved with drugs and they get themselves in trouble. But the effect of not having housing is what we're talking about here, is that lack of affordable housing and how it increases the susceptibility to drug addiction, which then in turn increases the number of people who will die as a result. As a society, we have to figure out how to do more. Neither one of these problems, neither the toxic drug supply, the problem with addictions, nor the housing crisis are simple things, but they require action. and they require direct action, less talking, more action, picking a direction, and moving forward. Again, as we will hear in some of these clips today, the war on drugs has been a failure. Having the police arrest people and try to put them into jail is not the solution. It never has, and it never will be. The solution is for us to create our society in a way that will help people to 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 grow and become the humans and the part of our society that they were intended to be.
So yeah, to the right here, the tent city. Again, we just see tents covered in tarps. People just, trying to live, trying to survive.
Thunder Bay has more overdose deaths per capita than anywhere in Ontario, among the highest in the country. When the house was in the city, we met with a group of mothers who had all lost children to overdose, many after getting off drugs, then relapsing. That includes Carol and Carl. She created a foundation in memory of her daughter, Dana. It tries to support people in recovery. Here's part of our conversation.
Dana had been sober for almost 10 months, and she had a relapse, which, due to the toxicity in the drugs today, she overdosed and passed away. I very soon after recognized the need for more resources. So a light went on with a few of her girlfriends after her passing, and we thought, wouldn't this be a great thing to do in Dana's memory, to start something in Thunder Bay and start recruiting all the mums, getting together and trying to find some solutions to this I call it a catastrophic crisis that we're facing.
Gord Johns, NDP, the riding of Courtney Alberni. If you say this is urgent, where's the plan? Where's the plan with a timeline and resources? They've spent less than 1% responding to this crisis than they did on COVID-19. Why? Because of the stigma. The war on drugs has failed. We know that. Everything should be grounded in evidence-based policy and led by experts, not politicians.
And as Gord clearly put, Gord Johns, by the way, Gord clearly put, where is the plan? Where is the money being spent? How is it being spent? Why is there more interest and investment in other things outside of our country than looking after the people inside? The challenge of homelessness and underhousing combined with addiction and overdosing contributed by those factors, we need to get on board and get stuff done. And now, an excerpt from the former Health Minister, Patty Hajdu.
Patty Hajdu, Member of Parliament, Thunder Bay Superior North. Prior to this work, I ran a large homeless shelter in Northern Ontario. I have witnessed people who have died of overdose. I mean, it's probably one of the most traumatic work experiences of my life, attending the shelter late at night where a young man lost his life. But I'll never forget the call to his mother. And, they were not close. This young person had just been released from prison. It's a very sensitive time for an opioid user. They've been sober for a long time, and they don't necessarily remember or know what dose will be safe for them. And this mom asked me for help finding clothes to bury her child. They were living in a really desperately poor situation with no financial resources. And she was devastated that she had lost her son, and she deserved all the respect in the world.
And now, John Barlow, MP from Alberta.
John Barlow, Member of Parliament for Foothills, Southern Alberta, Conservative Party. For my wife and I, we went through this with our oldest daughter, and for us, it was like a bolt of lightning. kind of lost track of her for a few weeks. Obviously as parents, you're phoning, you're texting, your Facebook Messenger, whatever you can do to kind of keep in touch. And finally, I drove up to Calgary, went to her apartment, and just pounded on the door for what seemed like half an hour until she finally answered. And I will never forget opening the door and seeing her there. She didn't look like my kid, didn't look like my daughter. It was the scariest moment in my life. Now, thankfully, I'm extremely proud of her, how she has recovered and is doing so well 8 years later. But at that moment, I thought I'd lost my daughter. I really assumed that I would take her to the hospital and they would immediately put her in a treatment program. But for the doctor to come out basically and say, yeah, she's overdosed on fentanyl, she's good to go, you take her home. I couldn't believe it. It was like, you're on your own.
And now one of the most difficult interviews to listen to is Faith Pettypiece talking about the loss of her daughter. As a father myself to 3 wonderful women, it is heart-wrenching to hear the stories. Also coming from a place where I personally have experienced the life of living with people with addiction, that it is such a difficult thing to deal with as a parent. This is difficult to listen to, but it brings us to the real things that really matter.
My name is Faye Pettypiece, and I am the mother to Jessica Jonason, who passed away sadly on August 6th, 2022. Much like Carolyn's story, my daughter was almost 3 years clean. I spent money and sent her away to a treatment center. She was doing so well. And then I wanted to go out on my birthday, August 5th, with my 3 kids. And she wanted to stay out. And as a mother, I thought, well, she's 30, she's going to be 32. I can't say no. But I did have a lovely dinner with my 3 children. She stayed behind and met up with a friend. And again, it was a lethal dose of fentanyl that she took. The coroner said there was no trauma. It was instant. She died in my home. I found her. I could not.
You found her?
I did. I could not revive her. I had to call my husband down because I panicked. And he came down, and we had 911 on the phone. The paramedics came, the firemen came. I don't know how many police were at my home. And the paramedic came up to tell me that my daughter didn't make it, but I kind of knew. As a mom, you kind of know. And I just kind of went numb. I don't even remember how many people were in my house. There were so many police officers coming and going and fire trucks. But the saddest part for me that I won't get out of my head, I can't get out of my head, I've even gone for help for it, is when they carried her out in the body bag. And they drop her beside the door. And then they bring the stretcher up and they put her in the van and take her to the funeral home or to the hospital. I just think her, being clean for that long, her body couldn't take it. But how do you know they're going to relapse, right? Like, it as a mother, you feel like a failure, like I shouldn't have gone out that night, or I don't know. It's tough.
What the mothers in Thunder Bay want is more treatment and recovery beds. They don't want other parents to lose their children to overdose.
Next, just a powerful, simple statement of fact, of reality, of humanity.
Do what's right. I don't care how long it's going to take. People are dying every day. Let's get moving on this.
Then the final excerpt I have on this, it talks about addiction and about how we treat it as a society and how important it is to understand A very interesting thing, because everyone talks, and I talked about it. Then when I heard this, it really was the penny dropping, or the nickel nowadays, but the penny dropping in understanding that the battle really is about addiction, about the need to be addicted, the necessity, what drives people to become addicted, not necessarily even the toxic drug supply. It is, how do you fight addiction? How do you teach people? How do you love people enough to allow them to not have to be dependent or not have to have the drug to feel better? You heard during one of the excerpts, the person the recovered person was talking about how, when they took that drug, how fantastic they felt, and they had never felt so good before. And that's the problem. How can we feel good without that? How can we as a society do that? How can we provide housing? Why don't we provide housing and places to live and lives to live that will do that? That's our responsibility as a society.
So when the Public Health Agency of Canada says toxicity of supply continues to be a major driver of the overdose crisis, when they say that 81% of all deaths involve fentanyl, you just dispute the premise?
I believe that those individuals are seeking a high because of their addiction. If we replace the problem of describing it as a toxic drug supply with instead the problem is addiction, which is a biological disease which needs treatment, the solution ends up being recovery. What those individuals are doing when they talk about a toxic drug supply is they're activists and they're advocating for a safe drug supply as the alternative. They are not neutral in their argument. They're saying that if we provide high-powered opioids like hydromorphone, which for the record is 5 times more powerful than street heroin, then that will solve the problem. Because the problem is the addiction itself, the addiction is the disease, and that is sadly what's killing so many of our family members. I can tell you now, it will not solve the problem.
And now we're going to switch to an interesting topic. 2 more things in the show today. First is about homelessness and pets. This is another excerpt. Very interesting to listen to. Please give a listen. And right away, my apologies for the sound of this audio. It's pretty rough. I did record it from the radio onto a recording device. So I'm going to try and clean it up a bit, but it is a bit messy. Apologies ahead of time.
Good morning.
Hi, good morning, Mike.
So, if I understand it correctly, this was the first time that community veterinary outreach has gone into Kingston, but it's been around for a while, operating in Ottawa for a couple of decades. How did it all start?
Yep, so Community Veterinary Outreach is a registered charity that's based out of Ottawa that really aims to improve the health of homeless individuals and their pets through a One Health model of care. The charitable organization was set up by Dr. Michel Lem, a veterinarian based out of Ottawa, and since the inception of the charitable organization 20 years ago, there are now regional clinics that are based from Whitehorse, Vancouver, all the way through to Halifax, including 4 clinics that are set up within Ontario. So within Toronto region, Simcoe, York, Ottawa, and now we're excited to have an organization region within Kingston as well.
What showed you that there was a need for this in Kingston?
We know from working with our partners at the Integrated Care Hub that there was a significant population of pets with the unhoused individuals within the community. We were very fortunate this summer as we started to set up the Kingston region to have Queen students that did a needs assessment out at the Integrated Hub, where we identified that there were approximately 20 dogs and several cats that were housed with individuals within that community.
And when you went to Kingston, what did you see?
It was a fantastic day that we had last week. So in addition to myself, there are 3 other regional directors, Dr. Ia Marceleson, Leanne Couvret, who is a nurse that works with Providence Care, and then Myra Emery, who is a social worker who also works with Providence Care. And we had the privilege of having 16 clients that day. So there were 14 dogs and 2 cats. In addition to the key with community veterinary outreach is the ability to be able to provide human health services as well. So Kingston, Frontenac, Lennox, and Annington Porch Bus was on site as well to be able to provide sexual health training, provide COVID and flu vaccines, as well as smoking cessation.
That's interesting. So adding in a human health element in with the animal health. So let's just first look at the animal health. What condition would you say the animals were in that you saw?
Yeah, so it's sort of a bit of a misconception that the pets that are with unhoused individuals might be unhealthy. But as we found out, and is consistent with the literature, using body condition scores, so how well is the condition of those animals, we found that all of the animals that we saw were in very good health. We saw 2 minor health conditions with ear infections, which is not unlike something that you might see with pets within the general population. And this is really consistent with what the literature reports, where pets that are with homeless and housing vulnerable individuals are just as healthy as the general population. And sometimes we even find that the animals within that population are actually less likely to be overweight and an ideal body condition score and weight.
So why do you think that is, that the health levels of these animals was fairly good?
I think it really comes down to the level of companionship that those animals provide. They are an extremely important aspect of the lives of homeless, unhoused individuals, even to the extent where we know that homeless individuals will consistently report feeding their pets before themselves. And so they will put their pets before themselves, making sure that they're taking care of them to the best of their ability, to the detriment of themselves at times. And so hopefully with the charitable organizations such as Community Veterinary Outreach, we can help alleviate some of that stress by not only providing wellness exams, vaccinations, but also donations of dog food and cat food, so it's one less stress on that population.
So I know that some people might, see an individual who's experiencing homelessness and see that person with an animal and think, oh, that's not responsible. It's not a good idea to be caring for an animal when you're, living without a home. How would you respond to that? Yeah.
Yeah, and I think that's very unfortunate that there is that perception out there. And I really think we need to look at it more from a broader societal context and really be asking, how can we help homeless people so that they are better able to take care of their pets? And so really looking at what can we do to minimize the amount of homelessness within the community. We know that pet ownership for those individuals that are homeless and vulnerably housed really provide emotional support, companionship, and at times that really is the only level of companionship that they have. And the literature shows us that individuals that are homeless that have pets actually have a lower incidence of depression than those without pets. And so they really play a valuable role within the lives of homeless vulnerable individuals within our communities, not unlike they do to the general population.
And then your ability to then connect with these people through their animals, did that was that a way that you were able to help look after their own human health needs?
Yeah, without a doubt. So as part of our clinic, there were 16 dogs, pets that we examined. And then on the human health side, with our partners at KFLA Public Health and Providence Care, we were then able to see, I believe it was 18 members of the community as well, ranging from sexual health, smoking cessation, as well as vaccination. And as the program grows, we hope to be able to increase the number of human health services that we're able to provide.
And finally, will you be coming back to Kingston or expanding to other communities in the region?
Yep, so we're certainly hoping going forward that we will be able to hold clinics in Kingston on a quarterly basis. And that's then in addition to the other clinics that are already established throughout the province and across the country, and the hopes that the program does grow into new regions as well. And if people are sort of interested in trying to set up clinics within new regions, they can reach out to Community Veterinary Outreach through their website.
Great. Thank you very much, Andrew.
Thank you very much.
Andrew Winterborn is the Regional Director of Community Veterinary Outreach. He is a local veterinarian in Kingston.
Most amazing thing I found in that whole clip is the fact that the pets, for the most part, of the people living in tents and living rough and homeless are in as good or better shape than the ones with everybody else. Because one of the things he pointed out, they get exercise. Okay, we're going to move on to our next topic for the day, and this is going to be all about tent cities and the effect of tent cities on people, how the police are reacting, how society is reacting, and how negatively, for the most part, the approach is to people who end up creating tent cities and who create and try to create communities, which, hey, we should be able to do better and, create communities for them. Can do it in the same space. I mean, we have the technology. It's there. Just has to be done. And here it is. This is Matt Galloway, and this is an excerpt from The Current. Great show, too. Hey, I'm really loving CBC today, but what can I tell you?
This particular camp, because of such a dry summer, we did call 311 about because they were having fires and we were concerned about the safety of the community and the local area. There's lots of needles around. One propane tank is taken out, but another one pops up soon after. So the kids don't use the treehouse anymore. There's a tobogganing hill or kind of a path that goes down to the creek, and they don't use that anymore. Our kids like to play street hockey out in front, and they are scared to do so now because they're worried about people coming up from the path.
Jessica Therian lives close to a homeless encampment in Edmonton. Over the past week, police and city workers have been clearing tents and structures from a number of these locations. Police say the encampments are dangerous and now being infiltrated by gangs. But people who live there, people like Chris Burgess, say they are doing their best to keep things clean and safe.
I got a lot of friends that live on the streets and use drugs. I'm one of them. So, you do what you got to do to survive. And, really, it's a shame, I don't know why the cops would kick people out, Not everybody can afford a place to live, I'm one of them. I just sit down here and say, hey, look, we're not all bad people. Really, this is technically city property, so, if it's maintained, clean, I don't see what the problem is, I don't see the harm.
Advocates for people experiencing homelessness are suing the city of Edmonton over how these camps are being torn down. Aaron Paquette is a city councillor and Edmonton's deputy mayor. Aaron, good morning.
Good morning.
Why are these camps being cleared now?
Yeah, these camps are being cleared mostly at the behest of Edmonton Edmonton Police Services, and the reasoning they give is that there are some inherent dangers that have to do with crime, human trafficking, outbreaks of disease, sanitation, and fire threats. essentially that organized crime also tends to prey upon the folks in these camps. And so when, the paraphernalia of drug use items and things like that start to increase in the area, in the encampment sites, it is deemed a public health risk, and then the request is that the city support a cleanup.
Just to be clear, I mean, the police have said that this is not a unilateral action, that the city has been involved in this as well. City officials, including bylaw officers, park rangers, fire as well, that it's not just police who are doing this.
Yeah, so, and that's a good point. And I guess if we want to answer that question, we've got to back it up a little bit. Why are we in this situation? Why does the city have to develop an encampment policy? And that is because the level of government that is primarily responsible for housing, for shelters, for mental health and addictions, is frankly not doing their job. In 2019, they cut funding to all of those areas.
Right.
Here we are today post-pandemic. And so cities like Edmonton and across Canada are faced with this situation that, frankly, is a provincial government responsibility.
Let me get to that.
And yet it is being downloaded onto municipalities.
Let me get to that in a moment. Let's focus for right now on these encampments themselves. The chief of police, Dale McPhee, has been warning about the dangers of the encampments. You ran down a number of the concerns that police and others have. Have a listen to the chief in an interview with CBC last month.
We've got first responders pulling people that are literally burnt to death out of fires. That's not okay. As cold weather gets, you got nylon tents. Then you obviously have some of the people that are in those encampments, criminal activity that's preying on some of the vulnerable population. You've got public health concerns. Last 2 years, we went from 6,500 encampment complaints to just about 15,000. This is not okay. This needs a different approach. These things all need to come down.
At an encampment on Sunday, there was a fire. 2 people were taken to hospital. There was a propane tank explosion. There was also, and this is separate from that explosion, but a body was discovered at one of these encampments as well. The chief says that's not okay. Is that acceptable?
Well, no, none of this is acceptable. And in fact, what happens when we have an encampment that's broken down is, sure, the city can get in and clean up the biohazard waste. But once it's all said and done, the encampment literally returns the next day.
Is there anything that the city can do to prevent that, so that people are safe, but they don't just set up another camp down the road?
No. Some of them may avail themselves of the services that are offered. They're offered rides. They're offered help. But some of them, frankly, when it comes down to it, want to feel some form of self-reliance and independence. And so, yeah, they will set up again.
As you understand it, where are those, if the encampments are being broken down at the behest in some regards of the city, but also with the police and fire involved, where are those who are in those encampments? Where are they supposed to go?
Well, that's the question, isn't it? So there are shelter spaces, but people don't want to go to those. In fact, because the province is in charge of shelters, what the city did is we drafted minimum shelter standards that they could follow, that through consultation with the homeless community, they said, yeah, if it was like that, we would go to shelters. But it's, at such a state that even the minimum shelter standards are not being employed by the province, and we don't know why, and we don't have the authority as a municipality to ensure that those standards are being met.
The Premier of Alberta, Daniel Smith, has pointed out that the province is funding 1,700 shelter beds in Edmonton. What additional help is your city looking for from the province?
Well, let's look at it this way. What we are looking at is last actions. So everything else has failed, and so now they're funding shelters. By the way, there are more people who are homeless than there are shelter spaces available in general, but those shelter spaces will have, empty beds because people don't want to go to them. So we are in this position as a last resort. Really what the province should be doing is providing housing, or providing spaces for recovery. And these things just are not there.
Advocates for people who are living rough say that in the absence of appropriate shelter, or shelter that people don't feel comfortable in, the city should instead support encampments with fire protection and sanitation instead of removing those sites. Is that the answer, do you think, to help people live more safely on the streets?
It's a last line of defense. It's absolutely not an answer. It is absolutely something that we've been talking about as a city council and as a city overall. Is if this is our reality, if honestly the federal government and the provincial government are not moving fast enough in order to help us with this, then what do? Do we manage these encampments? By the way, people are paying their income tax dollars specifically for these things to already happen. They're not paying their property tax dollars for that, but the city is spending so far $250 million in effort of housing and shelters, and we need help. We need all levels of government to take this seriously. Danielle Smith called the mental health and addictions crisis in our streets a crisis. So the question is, where is this crisis movement?
We'll leave it there. We're going to speak more in just a moment about how those who are suing the city see the city's responsibility in addressing this crisis. In the meantime, Aaron Paquette, thank you very much.
Well, thank you very much. And honestly, I think that we're going to find a lot of similarities between their position and the city's, but here we are.
Here we are indeed. Aaron Paquette is a city councillor and deputy mayor of Edmonton. Sam Mason is president of the Coalition for Justice and Human Rights. That group is suing the city over its handling of encampments. Sam Mason, good morning to you.
Good morning.
What are you hearing from people who've been living in encampments about the impact that the removals, including the ones this weekend, are having on them?
I mean, for many of them, it's a familiar story. I think that word has gotten out about the lawsuit and the injunction, of course. So there's maybe a little bit more renewed hope, and maybe there's a little bit more, it might hurt even harder knowing that it's happening, even though we've made our point that this violates their human rights. But yeah, I mean, it's tough. And when we look at the weather coming up, it's I feel truly, truly sick.
Where are they going? Where are the people who are in those encampments? As you understand it, where are they going when the encampments are torn down?
I was at one just at the end of last year, and I literally walked people's stuff over half a block. So I know that that's where most of the people are going.
Just setting up another site.
Yeah, of course. Yeah. I mean, I heard Aaron talk about the 1,700 funded spaces, but funded spaces are not actual operating spaces, and nor are they, as he mentioned, adequate for most people.
What do you say to people, including police, fire officials, and others who are raising concerns about safety in these encampments? Gang activity that preys on the residents there, human trafficking. 2 people were taken to hospital for burns this weekend. A body was found at another site. The comments from public health officials and others say that these aren't safe places.
I mean, we can agree that in general, living unhoused is not a safe option for most people, but according to the city of Edmonton, there were no arrests or warrants executed or tickets issued during their encampment displacement. So we really maintain if they want to address if they want to address the crime or the risk, then they can do that. And like we said, even with fire safety, there's opportunities to, create warming spaces within encampments. I listened to the cross-country checkup and heard that woman living in an encampment in Kelowna, and she says they work with bylaw and they create separations so that there's no tent or fire risk. There are other options.
And so is that, I asked the deputy mayor that, and he said that that's not the solution. But to you, is that one of the solutions that you think should be put forward, that these encampments should be made, safer is a strange word, but in some ways, safer places with fire protection, with sanitation, etc., instead of tearing them down just so that they can be rebuilt across the street?
I share the same concerns as the deputy mayor that encampments as a rule are not the answer, but they are a reality. And so what are we doing in the interim while we've been waiting for the province to step up? We've been waiting for, all of these other options, like Mr. Paquette said, that's not there. And so this is a reality. And what are we doing in the interim?
It's interesting because he said that he felt that you and he would agree, and that your group and the city would agree on many of the positions here. To a lot of people, it's not acceptable that there are encampments across this country, not just in Edmonton, but in cities and small towns right across this country. They also find it really difficult to understand in a country as wealthy as ours why people are still living out on the streets. What is the shared position that you have with the city on what has to happen next, do you think?
Yeah, I think when you look at the big picture, of course, I think the city and I have a similar position, that in general, like what's really the biggest risk to these folks is poverty and living on the streets. And so, but that's where we're at, and it's only getting worse. So of course we agree that the ultimate solution is permanent, supportive housing, addressing affordability, addressing the crisis of, like, I work with people who are, never have considered being homeless before in their lives, and they are on a fixed income, and they're getting issues of, their rent's going up $500, and they are on a fixed income, and how are you supposed to rectify those two things? So ultimately, yes, of course, me and the city have the same position that homelessness shouldn't exist, but what the crux of the matter is that right now the city does have power over how they're responding to encampments, and what they are doing is violating people's human rights, and they're. Yeah.
We're going to talk more about the legal aspects around that, but I'm really glad to have you here as part of this conversation. Thank you very much.
Mm-hmm. Yeah, no problem.
Sam Mason is president of the Coalition for Justice and Human Rights. Julia Riddle is a constitutional lawyer in Vancouver who's been involved in cases involving people experiencing homelessness. Julia, good morning to you.
Good morning.
Help us understand this. At the center of these lawsuits is Section 7 of the Charter of Rights and Freedoms. Can you explain what that is?
Yeah, so in basic terms, Section 7 promises people the right to life, liberty, and security of the person. What that means in plain language is that the government generally is not allowed to put your life at risk or harm your personal security, which means cause you severe psychological harm, or take away your liberty, which includes your ability to make fundamental choices about your own life. So when it comes to living outdoors, you as an individual have a right to protect your life, your safety, your dignity. And that means, practically speaking, that's been interpreted by the courts to say you have a right to set up a tent, to stay safe, to keep yourself from dying of exposure. And the government can only interfere with you doing that, with you protecting yourself, if it's, one, trying to accomplish an important goal, and two, what it's doing to accomplish that goal is proportionate. So it's logically connected to that goal, and it's trying to harm those rights as little as possible.
How is that complicated by the claims we've heard from police and others that these encampments are dangerous? That, again, I ran through a list of the things that people are worried about, including human trafficking, gang activity, fire risk, what have you. How does that complicate those rights that you're citing at the center of this lawsuit?
So I think it's important to start with what is creating that risk. Encampments are not the problem. The problem is not, because encampments are just people sleeping outside, people who don't have homes. The problems that you're seeing when you're looking at things that are specific, like crime, like human trafficking, like fire risk, well, we have those in places that are not just encampments. Those are problems that people create. And the question is, what is a minimally impairing measure to deal with that? So, what they're saying, when you have a case where the city's response is just to go in and get rid of people's homes, you have to ask, well, is there something you could do to deal with those problems that isn't just bulldozing their homes? If I live in an apartment building, if there's a fire risk in my building, they don't raise my building to the ground because they recognize, well, that's going to cause more problems than it solves.
We heard earlier from a resident who lives near one of the encampments in Edmonton, and she fears for her family's safety. Her kids are afraid to play in the neighborhood park. They worry about needles and fire risk in those communities. Do the rights that you're citing, do they also apply to those people who live near those encampments?
Of course. But I mean, that's where I think you have to look at, and cities need to have an evidence-based approach to these sorts of issues. One, you have to look at, okay, are there actual safety risks that need to be dealt with in the area. And I think your previous guest made a point around this, that, if there's crime, the city has the ability to deal with that. We already have laws around crime. You should be enforcing those laws. But the problem isn't that homeless people exist. The problem is then you need to deal with the laws around crime. And there can be a lot of panic around encampments. There can be a lot of people saying, well, I don't like looking at homelessness. I see a needle on the ground, and I think that's inherently dangerous.
Do you understand where that comes from?
To be quite honest, I think we have a real sense of shame as a society that we've allowed the world to get to this point, that people are living in parks en masse, and that is the only way they have to survive. But we don't help those people by making their existence illegal. That is the reality of the world we live in. And that doesn't mean that it's legal for us to go and destroy their homes.
What do we just have a minute and 30 seconds left. What do we do about this, do you think? I mean, this is an issue that's playing out across the country. In Halifax, for example, there's an encampment set up in the Grand Parade, a downtown square in front of City Hall, that people who are living there have electricity that's supplied to them. In the city of Toronto, there are giant kind of domes that are over parks and fields where they've become kind of not temporary, but almost permanent shelters now. What do we do about this, do you think?
Mm-hmm. I mean, I think, as both your previous guests said, we need housing. We need housing that people can afford, and we need to have that at a rate that matches the rate of affordable housing we're losing.
But in the absence of that, right now, what do we do?
Yeah. In the absence of that, we need to recognize that, wishful thinking does not get rid of homelessness. But saying nobody deserves to live in an encampment is not very helpful to somebody who doesn't have anywhere else to live. So you treat those encampments as necessities. You give those people safe sources of heat, safe sources of tents. You organize them in a way, like you give people legal places to set up their tents, and you don't just try to ignore the problem away, because if you do that, that's how you end up with encampments that are too big, that are too dangerous, where people don't have that ability to look after themselves. Because people who are living in encampments generally, Chris, your first guest, said it best, they are doing what they need to do to survive. There are many encampments in this country that have been set up that are incredibly safe. So look at those examples, learn from them, and let people do what they need to do. But you're not going to get rid of the problem by making it illegal, and that's not constitutional.
Julia, really glad to talk to you. Thank you very much.
Thanks.
Julia Riddle is a constitutional lawyer.
Very interesting interviews for sure. Thank you. CBC, love them or hate them, they have they really do have the resources, and people will talk to them. It's really quite good sometimes. You have to pick and choose, I agree, but I will bring other excerpts from CBC and other programs as they come up, things that involve the housing crisis in Canada. And again, kind of a last couple of moments of this show this week, just want to talk briefly about solutions and about working towards solutions. I know that there is a new not-for-profit that's going to start up in January that's dedicated directly to solving the housing crisis, really, because the housing crisis in Canada and in North America is not an easy thing to solve. It's a tangled web of problems, from social action problems to money problems when it comes to profitability. The problem of why is there an undersupply of housing? Why are there not enough houses? Why does the construction industry not jump in and build hundreds or thousands of new homes? Well, hey, if you look at that, you'll see, if you look at the real estate market right now, you can see that what's happening is that for the first time almost since the turn of the 21st century, statistically now, it is that this is the first time housing prices have gone down. And the reason isn't anything else other than affordability. People can't afford to buy a house. They can't afford to rent. People keep, they buy houses to rent them. That takes a house off the market. We have a supply problem. This is aside from the societal problems that, well, it's in conjunction with the societal problems that don't pay people enough. In the previous podcast, you would have heard another speaker that I listened to talking about how over a 5-year period, the price of housing went up 60% and the wages went up 6% in the same period. So how can we cope and survive as humans without additional support and additional something? That's my understanding of what community/governments are supposed to do for you. And this is part and parcel with the entire housing crisis. So I'm hopeful that this not-for-profit is going to work towards actually providing real-life solutions rather than talk, and moving on, and be able to point out where the real problems are rather than, just political speak. Anyway, I will try and get off my soapbox now, and I hope everybody has a great week. This is Stephen Haylestrom, Let's Talk Housing, 92.7 in Peterborough on Trent Radio, Community Radio. Thank you, Trent Radio, for having this show on the air. You can also find us as a podcast, and really loving it. I hope everyone has a great 2024, and if you need housing, I hope you find it. And reach out, please, to me, and glad to assist in whatever way I can. And there you go. Have a great day. Thank you very much for listening. Appreciate it.